we must demand a very different kind of system. So one of the things I commend is I think that our department and your mental health subcommittee are on the same page. One of the recommendations that came out of that committee was how do we break down those silos and make sure we're organized in a way that the mental health system works together, and this was our first step. I can tell you we have great success in working together with our two divisions and with our contractors and our facility directors across the state. But perhaps the most striking example of how collaboration has to work in a department, and one that we can point to, is our efforts around meeting requirements of our Department of Justice settlement that we call Transitions to Community Living. And in our division, in our department, there are no fewer than 6 programmatic divisions that are responsible and have to have a part to play within that response. A Division of Mental Health, Developmental Disabilities and Substance Abuse Services, Division of Aging and Adult Services, Division of Social Services, Division of State-Operated Health Facilities, and Division of Medical Assistance all have major roles to play in that effort. They're all under separate deputy secretaries, but we work together to make sure that the implementation of this goes forward. One other move that Secretary Bosch made was to bring programmatic responsibility for this settlement under the Behavioral Health and Developmental Disabilities team. So Jessica Keith, our strong ADA advisor, reports to me for those programmatic functions so that we integrate her within all of those activities. But it's not just the programmatic divisions that have a responsibility. Obviously, we have a significant role for our legal section because it is a legal settlement. Finance has to be a partner in this every day. Our HR section has to be a part of this as we go forward, making sure we have the right positions at the right place. And of course, all of our compliance functions under Mark Payne have to play a part in this role. So what I'd say to you is that that integration of all of our divisions, of our programmatic divisions, and our support functions, including our IT, which is a critical component of this, is the only way we can be successful with this. This is a Department of Health and Human Services. It's not a series of separate divisions and sections. We work as a department because the Secretary demands that we work that way. We work as a department because the citizens of North Carolina demand that we work that way. It's a complex organization, but that complexity is because we have such a wide variety of things that work together to improve services for the citizens of North Carolina. We haven't made it yet. We're certainly not finished. We have a ways to go, but we have a great pathway toward creating a sustainable future and success for this department as we go forward. Thank you, Mr. Chairman.
Thank you, Mr. Richardson. Mr. Gogol.
Thank you, Mr. Chairman. Good morning to you and the members of the committee. My name is Mark Gogol, and I'm the Director of Human Resources for the department. I have over 20 years of HR experience in both the public and private sector. I would like to give the committee today an update on the staffing in DHHS. The improvements we have made to date are continued staffing barriers, additional opportunities for improving our staffing levels, and the status of the 2 new actuary positions allotted to us from the legislature. We have made incremental improvements in staffing at DHHS during the past year. As you may recall, we received from the legislature in last year's budget the requested salary administration flexibility for our hard-to-fill medical and allied health positions. This was an important enhancement for our ability to attract and retain critical direct care staff. We have leveraged this flexibility in over 80 staffing and salary actions to date. We thank you for your support with that much-needed request. Additionally, we have streamlined our own internal recruitment salary administration processes to accelerate hiring decisions by eliminating redundant or non-value added steps or documentation, reducing our process time by almost half. Secretary Bosch championed early in her tenure the need to address critical staffing challenges in our department. With the salary flexibility we received last year, we were able to finally fill open forensic pathologist positions at our medical examiner's office that were vacant for almost 2 years, as well as medical director roles in our facilities. Lastly, it was important for us to partner even closer with the Office of State Human Resources on our staffing challenges, to obtain their assistance on approving much-needed exceptions to salary and classification actions. Even though we are making strides in staffing positions at DHHS, we still have some difficult barriers to recruitment and retention in our department. Salaries for some of our hard-to-fill and specialized positions still lag behind the market. We were able to address some of this with your support in the recent salary adjustment fund, especially for those medical, allied health, and IT positions. We thank you again for your support in that area. We are aware that OSHR is in the process of conducting a statewide compensation project, which hopefully will develop new applicable market rate ranges for us to leverage. We still face changing skill set competencies needed for our positions due primarily to certain technology and programmatic requirements. This does require us to upgrade certain positions and recruit even harder for qualified applicants. An additional challenge for us is that the full administration process to staff positions or complete salary actions in state government may require approval and review outside of our department. This adds time to the decision-making process and in some cases has hampered our ability to fill positions as we have lost some candidates in the process. Lastly, we continue to be challenged with historical double-digit turnover rate in our department for a variety of reasons. Retirements, the growing job local market, salary pressure, and limited bench strength. There are potential opportunities, solutions that can assist us with our staffing challenges in the department. Salary administration flexibility for IT classifications would be very beneficial in addressing our changing technology skill set needs. We are aware that there is a provision in the recent budget to study this possibility, which will be spearheaded by the Office of Information Technology Services in partnership with OSHR. We are hopeful this will address some of our critical needs. Also, additional delegation of authority to us from the Office of State Human Resources for specific job classifications would eliminate the added administrative process for approval and speed our hiring decisions. We have requested this authority recently so that we can more effectively manage within our means. Lastly, we are developing an enhanced internal centralized process for strategic recruitment for key hard-to-fill positions in both leadership and our technology areas. We are including OSHR in our approach to leverage all possible resources within HR. More outreach by us than is needed. Finally, I do want the status of the committee on 2 new actuary positions in our department. As you are aware, DHHS was granted funding in the recent budget for 2 new actuary positions within the Office of the Secretary to focus on the Division of Medical Assistance. These positions are posted and will require a focused search on our part. We anticipate beginning the interview process for these positions at the end of the month. I thank you, Mr. Chairman, and the members of the committee for the opportunity to present this information to you today.
Question from committee members at this time? Senator Tarver.
Thank you, Mr. Chair. Since Deputy Secretary Richards opened the door, I'm going to walk through it and ask if the question that's, I think, on a lot of folks' minds, and we're looking into this, is based on the comments, and I'm going to paraphrase that DHHS is a complex organization due to the number of functions and departments and things going on. Would it be deductively reasoned that by creating a separate department for certain functions, we would simplify things for you guys?
Madam Secretary.
Thank you, Mr. Chairman. Senator, thank you for that question. Absolutely not, in short. Our portfolio is broad, it is diverse, but it is intertwined. A human being is one human being made up of body, soul, mind, needs, and our department is there to fulfill that. So to separate parts of that out of the department will decrease, will go actually backwards. The entire direction of healthcare as an industry is to work this way, to work closer, to work collaboratively, to work as a whole. By taking one part of the department out, a division out, that actually the division that works with everyone would be against common sense to do that, sir. So the short answer is absolutely not.
Senator Robinson?
Thank you, Mr. Chair. And I guess this is to Mark Gobble, Ms. Gobble. You mentioned that in one of your slides that two things, that the salaries are still behind the external market rate. And so, and there you still have some positions unfilled. Can you elaborate on what are those? Are those key positions that you have that are unfilled? My concern is that are there some things that are impacting, you know, the progress within the department?
Yes, Senator. There are positions in certain parts of our organization that it has been a struggle for us to fill. For example, as the Secretary mentioned, we had the opportunity to add positions in our audit organization, which we have been doing. But it's still a challenge for us to find candidates for those positions because of the market for auditors. And we've been working with OSHR on that. We've been, they've been trying to do what they could for us with regards to looking at the ranges, but it's still a challenge. We haven't staffed it as quickly as we wanted to. That's the case in a couple other areas as well. The salary flexibility that we got for the medical and allied health has really helped us. We have a larger range to work with, so we've been able to address that. But there are some unique positions in the IT area, as I shared with you, that had the Office of Information Technology Services not, spearheaded that, we probably would be coming asking for help in that area as well.
One follow-up, Mr. Chair.
Follow-up.
And the other piece was in terms of the turnover. I'm always concerned about turnover in terms of continuity of work or getting something started and then suddenly all the staff is turning over, and then we constantly see that. And you mentioned here double-digit rate turnover. Has that decreased? Have you been able to stabilize some? What is going on there?
It's gone down a little bit, and it's gone down a little bit because when we came on, honestly, there was not a lot of bench strength in the organization. And when people did leave, we obviously had a challenge to backfill them. But it's gone down slightly because there was a number of retirements and obviously people changing positions early on when the administration came in. And now with some of those retirements ending, the numbers have dropped a little bit, but it's still, obviously double digits higher than we need it to be.
Chairman Heiss?
Thank you, Mr. Chairman. Looking at your overall organizational structure and seeing it kind of broken into 7 different areas and how they intertwine, and it may be something you have to report back to us. Can you give us a sense of how much of the budget of each one of those areas is cost allocated to Medicaid or receives a federal match for funds spent within the financial officer's office, the technology information office, those type of things? How much of that is really under Medicaid and pulling forward, and how much is separate in other areas?
Senator, yes, we can provide that information to you. It's quite complicated, quite extensive, and when we report in the subcommittee, if you would like, we can present that to you.
Representative Lambeth?
Thank you, Mr. Chairman. I applaud your efforts to restructure. I think that's absolutely critical with a large, complex organization to get the structure in place that's efficient, as you pointed out. My question relates to how many of these positions are direct reports to you, Madam Secretary, directly? Secondary to that, is that still too many? In other words, how you spend your time, I think, is absolutely critical for the state. And I want to make sure that you considered a strong second in command and not having too much on your plate so that you can travel across the state and you can listen to constituents and you can do things that you need to do in your leadership position.
And thank you for that question. We will be presenting all of this into the subcommittee on reorganization, but to answer your question very directly, this is about the standard of industry for an $18 billion organization reference to the direct reports. The reason that Medicaid, that the Division of Department of Health and Human Services, and especially the Division of Medical Assistance, was problematic is the organization has been this way for 40 years. There is no $18 billion corporation in the world that has not reorganized in 40 years. That does not pass the common sense test. Needs are different, obligations are different, skill sets are different. So for 40 years to work in the same manner, you had results that were not the best for the state. In the new model, which we are working in this model, we work collaboratively. So if you look up here, our direct report,